Hello, lovely learners. Welcome back to ALifeLearned. Today, I wanted to share with you about a very unfortunate loss here in London. We had a mental health advocate who was very well known in the community lose her life to suicide, unfortunately, on March 11th. As you might note from the title, her name is Kristin Donkers, and she did incredible work for only having been 25 when she lost her life. And so I really wanted to make this video to consolidate all the different articles and videos that I've seen about her, to share her full story, and emphasize that her loss is just another example of how desperately, desperately we need change before we keep losing really impactful, incredible people like her. So to start off, she had a really hard beginning. Her mother died when she was only 10 years old. Her mother had bipolar disorder, and I assume this contributed to her struggle. And so that was very difficult for her, of course. And she started struggling with anxiety and depression at a young age, around 13 is what some of the articles said, though I would bargain it was between the death of her mother at 10 and the age of 13. And then at the age of 13, she attempted her life for the first time. Thankfully, that was not successful. She was brought to the hospital and received some kind of treatment. But she's been in and out of hospital, had been in and out of hospital all through her life, and continued to struggle with finding anything that was actually lasting and helpful in helping treat her. Later on, when she, I think, was 16 or something like that, a few years after her attempt, she was diagnosed with bipolar disorder. And this contributed to a lot of her struggle in her childhood and her adolescence. And so, with some of the money that was left for her by her mother, she wrote and published a series of books that are called, I'm going to share links below about them. I believe it's the Zoe and Zach series. You can learn about it on her website, which is childrensmentalhealthseries.com. And it's been really big in London and in the Middlesex area in particular. It's played a really large role in making mental health a more normalized topic to talk about for children, which is important because the earlier you can recognize struggles in mental health, the earlier you can seek treatment, the earlier you can explore coping mechanisms and medications if necessary, and thus the less pain and struggle you experience overall, of course, because you're getting help earlier. But the ultimate reality is that the loss of Kristin is evidence that in all of the work and all of the advocacy that someone can do in trying to seek help, our system is still incredibly fractured and minimal compared to what people actually need, because she tried with all of her might, with everything she had and then some, to get help, and she still lost her life to her condition. So anyways, I just wanted to emphasize this book series that she wrote because it was one of the biggest things she did that had an incredible impact on the local area, and she was recognized in many ways for it. She got the Sharon Johnson Award for Mental Health for Youth, as well as a number of other awards in recognition of this book series. So if you have children, or if you know anyone who has children, definitely check out this website and recommend the book series to them. You can find it at your library probably. I mean, I guess if you're in the London or Middlesex area. If not, you can definitely find it online. And you can order it. And you can also petition your local elementary schools to order it for their own libraries, and then it'll be accessible to the students in your area. So I do highly recommend that. The books basically have two different characters, as I mentioned, Zoe and Zach, who go through different experiences related to depression, anxiety, bipolar, and ADHD. So it uses a lot of really simple language that children can understand, but it normalizes language that is related to mental health, and it helps children learn the names of certain conditions and learn that it's okay to take medication and necessary in order to be okay if you have certain conditions. So it's a really, really impactful series. It was launched in 2016, and I highly recommend checking it out one way or another. So it came out of a program that she and her friends, as I understand, built up called Reading to Flourish. And the idea is obviously to promote uh, discussion about mental health and to normalize an understanding about mental health, and that mental illness is much more common than a lot of people give credit to. And the more we discuss it at earlier ages, the less it will be a problem for anyone as they grow and develop. Because if you can know what's going on with you, you can cope and you can get help. And so the suffering is just significantly less, and thus the damage that can happen is significantly less, which so in the case of someone like Kristin could have potentially meant that she would still be with us, if she had those resources when she was younger. So the really cool thing that she did was once she published, she partnered with the Rotary Club here in London to make the book available to 150 schools, like elementary schools in the London area. And then she also expanded to Woodstock as well. I understand there are other areas that have also accessed it. I haven't done extensive research as to where it is, but I do know at least it's in the Southern Ontario area, and it's something that you can access whether you're in Ontario, in Canada, regardless. There's lots of resources, and I'll share a whole bunch of them in the description for you. So again, going to keep pushing this. Access it. Recommend that your local schools order it for their libraries, because it needs to be normalized language. It's the fact that we are still facing so much stigma and misunderstanding that is a big contributing reason to why we don't have the resources we need. There's just a real huge gap, it seems, in understanding regarding the need for mental health resources. Like, you can go to your doctor at any time, and it's covered by the Ontario Health Insurance Plan to seek your doctor for any physical medical problem. But you cannot go to a counselor for that. There was a program to access generalized counseling from, I think, Canada Mental Health Association. If you're under 25, I don't know if that still exists, to be honest. I know that when the recent Conservative government of Ontario came into power, they removed a lot of stuff like that, like prescriptions being covered and stuff like that. So I don't know if it still exists, but the point is that it was 25 and under. And so that's still a real problem, because, no matter what age you are, you can go to your doctor and have your healthcare covered by the insurance plan to seek physical health care, but you can't do it for your mental health. And that's just wrong. It's a huge gap in recognition that our mental health is just as important as our physical health, and it impacts our physical health hugely. If you're not familiar with my channel, I have videos that I've made where I basically figured out that I was having severe chronic nausea, in which I was accessing hospital resources like every few months. So I was using a lot of, tax dollars, they say, to deal with this condition, and it was all because I had anxiety. Well, and a gut flora imbalance. But I figured both of those things out on my own through research, and it was because I was able to get control of my mental health that I was able to resolve that situation. No doctor actually managed to help me with it. But the fact is, because I couldn't access mental health resources to deal with it or to figure out what was going on, I used way more hospital resources than were necessary. So anyway, that's just an example of me and how, like, there's countless situations where we're spending more money on hospitals and medications and doctor visits because people cannot access mental health care, and because it's not normalized to reach out for mental health care before turning to pills. And to be clear, I more mean medication for the physical symptoms, because sometimes medication is necessary for the mental health symptoms. It's more when we are treating the nausea with medication instead of treating the anxiety that's causing the nausea. But anyways, the other things I wanted to mention that I found just incredible about Kristin was that she had done so much at only 25. She had gone to Western and to specifically King's College University, which I'm applying to next semester. And she'd gotten a degree in psychology and disability studies. And then from there, she had applied to Windsor and was working on a master's in social work there. So she was all about learning. She was incredibly intelligent, a really good writer, obviously. And she did a lot of work in advocacy. She was from St. Thomas originally, so she has a lot of record of advocacy in the London area in particular. She was part of, for example, the London Police Services Board for Mental Health and Addictions. They have an advisory panel, which is really good to hear when you think about it. But she was a part of a lot of other things too, you know what I mean? And she worked with a grant to create mental health coping kits for children, which were distributed through the help of one of the nonprofits. I can't remember the name. But the point is, she was the epitome of a mental health advocate. She was doing everything she could in her power and then some, despite fighting bipolar disorder, despite being in and out of the hospital constantly fighting with her condition. She used all of her spare time that she wasn't focusing on her education and trying to expand her capacity to help and do work. She was using her time to help and do work. You know what I mean? Like, she was just an incredible human being who did a lot of incredible work in her just the few 25 years that she was here. And the reason we lost her is because our mental health system is pitiful at best. It's very broken. There are so many people out there who don't even know they need mental health resources and help because it's not normalized enough. And so in the end, my message is Kristin Donkers should not have been lost. She was a completely unnecessary loss, but she was lost to her condition. And I want to clarify, one of the articles said she chose to take her life, and that's a very bad choice of words. No, she didn't. She lost her life to suicide because her condition won. She did everything she could and then some. She didn't choose anything. Her choices were to fight, to work hard, and to do everything she could to advocate and help other people. But the system wasn't there for her. It failed her. And now we don't have the incredible work that she could have been doing. Like, she wanted to become a lawyer so that she could work on specifically mental health policy. She had so much ambition. She was so smart. She was so capable. And when you look at the track record of what she did in the few years she was here, it just gives you an idea of how much she could have done, would have done, and what an incredible loss she was. So with this, I just want to say, please check out the links below. Definitely check out the website that I mentioned, Children's Mental Health Series. Share with it on your Facebook, share with it on your social media. Talk to people about it, because it's important that children feel that mental health is okay to talk about. And advocate. Like, you can be an advocate too at any point. You don't have to do it as hard as Kristin did, but just email your local MP, email your local counselor and say, look at this obituary of Kristin Donkers. This is not okay. I want you to fight for us to have better mental health resources. I want you to tell council that we need to put money towards this. That's how we can all make a difference and just contribute a little bit to the incredible work that Kristin did. So yeah, if you know anyone who has been lost, to suicide, I'm so sorry, but please feel free to share your story below. I'm all ears. And if you know any advocates who have been lost, do share about them, because that further reinforces the point here that we need more work done in this area, and it needs to be done yesterday before we lose more and more people as incredible as Kristin. And yeah, just please feel free to share below if you can relate in any way, and share any articles that might relate as well. Check out the articles I put in the description, and please do join me again next week or sometime soon, where I try again to share a little something I've learned or experienced in life.